On October 1st, CMS's new HOPE requirements go live. They are now embedded in the Conditions of Participation, Section 418, and tied directly to payment integrity. That means every missed HOPE assessment, late symptom follow-up visit, or iQIES XML error doesn't just put hospices at risk. It rolls uphill to the MCOs, Medicaid plans, and Medicare Advantage organizations that contract with them. This is the domino effect of HOPE. 1. A hospice misses compliance. 2. The MCO still pays the claim. 3. CMS sees the failure. 4. The MCO fails in its oversight. 5. Both hospice and MCO share the financial risk, denied claims, audits, even funding loss. The good news? You don't have to scramble. We created the HOPE Implementation Documentation Toolkits and Training, a done-for-you back-office system with workflows, quick process guides, vendor resources, and role-based tools to help hospices and their MCO partners stay survey-ready every single day. Protect your hospice and MCO. Don't let the dominoes fall on your funding. See the link in the description.